Come and do practice questions with me today on the NCLEX. If you need help in this area, definitely want to watch this video as I do some practice questions today. So let's get right into it. So the first question says, a pediatric client with asthma is being discharged from the hospital. The nurse is assessing the family's understanding and support system to manage the child's condition at home. Which of the following statements by the family members indicates a need for further education or support? Select all that apply, and I'll say the answer choices more than once. And answer the question one more time. A pediatric client with asthma is being discharged from the hospital. The nurse is assessing the family's understanding and support system to manage the child's condition at home. Which of the following statements by the family members indicates a need for further education or support? Select all that apply. 1. The peak flow meter does not move when our child sucks air in. 2. We only need to worry about asthma attacks during exercise. 3. We keep the windows closed to reduce exposure to outdoor allergens. 4. Rescue and maintenance inhalers do the same thing. 5. We only use the maintenance inhaler when the child has an attack. One more time. 1. The peak flow meter does not move when our child sucks air in. 2. We only need to worry about asthma attacks during exercise. 3. We keep the windows closed to reduce exposure to outdoor allergens. 4. Rescue and maintenance inhalers do the same thing. 5. We only use the maintenance inhaler when the child has an attack. So this is a SATA question, remember, and it's asking you which one indicates that they need further education. So a lot of times I have seen in the past where when test takers are doing the question, are doing like a practice question or whatever, they will forget that you're supposed to pick the negative answer, you know, and so that's why it is good to, especially with SATA questions, read the question, read the choices, and then read the question again so that way you don't forget what the question is asking you. So here are the choices, right? Oh, in fact, if you want to play along as well, go ahead and stop the video right now and comment below what you think the answer choices are. Okay? So here's all the answer choices. All right. So the answer is going to be 1, 2, and 4. 1, 2, and 4. So 1 was, so these are what would need more education. 1, the peak flow meter does not move when our child sucks air in. 2, we only need to worry about asthma attacks during exercise. And then 4, rescue and maintenance inhalers do the same thing. All the other choices are fine. So here's the explanation. It says the peak flow meter does not move when our child sucks air in, indicates the need for further education or support. The misunderstanding of how to use a peak flow meter, which requires blowing out rather than sucking in, can lead to ineffective monitoring of the child's asthma control. The next one, we only use the maintenance inhaler when the child has an attack, indicates a need for further education and support. Maintenance inhalers, also number the last one too, because I was like, that one should be included as well. The last one as well. So maintenance inhalers are meant for regular use to control asthma, not just for acute attacks, highlighting a fundamental misunderstanding of asthma management. Rescue and maintenance inhalers do the same thing, also indicates a need for further education or support. This statement shows a lack of understanding of the distinct roles of these medications. Rescue inhalers are for immediate relief during an asthma attack, while maintenance inhalers are used for regularly to control asthma. We only need to worry about asthma attacks during exercise, indicates a need for further education support. This belief overlooks other triggers of asthma attacks, such as allergens or respiratory infections, and can lead to inadequate management of the child's asthma. And finally, we keep the windows closed to reduce exposure to outdoor allergens, does not indicate a need for further education support. This practice can effectively minimize asthma triggers, showing an understanding of asthma control in asthma management. Hopefully you got that one correct. If you got it correct, let me know below if you got that correct. All right, the next question says, a nurse is preparing to change the dressing on a client's central venous catheter. Which of the following actions should the nurse take to maintain aseptic technique and prevent infections? So let's all apply. So first and foremost, what I'll say right now is that, because I'm looking at these questions on a different site, and it's not aseptic technique, it's sterile technique. Okay, so this part is wrong. This is wrong though, because when you're cleaning a central line, you have to do sterile technique. Otherwise, bacteria can enter to the line, and then that can cause the patient to develop an infection, and that could be a very high mortality risk of infection. So the choices are, right, as far as to maintain that technique though. So let all apply. 1, clean the insertion site with an aseptic solution in a back and forth motion. B or 2, ensure the work area is free from clutter and dust. 3, place sterile drapes around the insertion site. 4, don the sterile gloves before touching the CVC site. 5, apply a mask to the client before starting the procedure, right? So this one, what do you think it is? Go ahead and stop the video, comment below, let me know what you think the choices are. One more time. Clean the insertion site with an aseptic solution in a back and forth motion. 2, ensure the work area is free from clutter and dust. 3, place sterile drapes around the insertion site. 4, don sterile gloves before touching the CVC site. 5, apply a mask to the client before starting the procedure. All right, so let's see. So this one, like I said, which one is the correct answer, right? So you're looking for the what should be done. So here are the answers. It's going to be 2, 3, and 5. 2, 3, and 5. Okay? I'm sorry. 2, 4, and 5. 2, 4, and 5. Applying a mask to the client before starting the procedure is an action the nurse should take to maintain aseptic technique and prevent infection. This helps to minimize the risk of airborne contamination of the CVC site. Putting on sterile gloves before touching the site is something that the nurse should also do as well. Ensuring that the work area is free from clutter and dust is also something that the nurse should do as well. Now, placing sterile drapes around the insertion site, is an action the nurse should take. There's something wrong with this website. Should take to maintain aseptic technique and prevent infection. Sterile drapes help create a sterile field around the insertion site, protecting it from contamination during the dressing change. So you should put a sterile drape. So sterile drape would be as if when you open up a sterile kit, it's like almost kind of like a cloth, and then what you do, you put it underneath whatever you're gonna clean, so that way it helps to maintain sterility as well, right? So that usually comes in the sterile kit too. And then of course it says cleaning back and forth is not a correct technique. So it should be cleaned in a circular motion, right? So you see how with this question, with this statement, everything was right, but the last part of it was wrong. So never back and forth, but always circular, all right? That's the appropriate way to clean the central venous catheter site, right? If you found this helpful, if you learned something, comment below. Let me know what you thought the answer was to each of the questions. If you're watching this on Facebook, thank you for tuning in. Facebook does not allow us to keep the videos on this channel, so you can head on over to YouTube to watch it, or we'll be posting it here as well for our subscribers as well, to have access to it conveniently. And then if you want to learn more about our question bank, we do have a question bank that offers a lot of questions to help you to prepare and help you to better answer the questions, and help you to think more strategically. I will link it below in the description, or you can comment below the word questions in order to get access to the question bank or to learn more how to enroll into that. Make sure you hit the like, follow, and subscribe button, and I'll see you guys the next time. Take care.